There we go. Okay, great. So thanks so much for having me. This is perhaps not your standard central bank presentation in terms of what I'm going to talk about, but we think it's interesting, and we also think it's a nice complement to some of the more macro literature that's been going on around sort of these same ideas about how to design policy during COVID-19. And just as a sort of small side point, if I look away from the camera, it's because I have all of my faces on a different screen next to me. So it's not that I'm not paying attention. This is joint work with Jackie Aridi, Wyatt Brooks, and Terry Johnson. And it's about trying to deliver cash to a vulnerable population that might not otherwise be covered by sort of standard government policies that have resulted during the crisis. All right, so I suppose at this point we don't have to talk much about what COVID-19 is. It's a giant shock, but what I want to focus in on in particular is this idea that one of the groups that's been at sort of like the forefront of this contraction are small businesses. And there's been a lot of work recently, some of which I know has already been presented here, on looking at the contraction and the problems facing small businesses in a shock that seems like quite a bit of it is driven by low demand. So in the US, for example, this type of issue has resulted in something like the PPP program, which is a set of partially refundable government loans that small businesses can take out. But there's been this growing recognition that these types of programs are likely not going to work particularly well in developing countries. So just as an example, the PPP requires that the government monitors employment changes within these businesses to figure out whether the firm has triggered the ability to not repay the loan. So taking the loan and turning it into the grant. Now, of course, if you're in a developing country with high informality that are perhaps not being covered by the government, these types of restrictions on the programs that are designed to help small businesses are likely not going to be particularly useful. And so, for example, in Kenya, where our study is going to take place, the government's been doing a lot of things to similarly help small businesses, including tax relief and some other programs I'll talk about. These are mostly focused on the formal economy, and as I'll show you, most people living in slums and sort of the most vulnerable informal populations are not being covered by these same types of policies. And so in response, there's been this growing push for thinking about unconditional cash transfers. So taking out the conditions required in, say, the PPP or other types of programs and just simply handing resources to business owners. Now, there's been a lot of theorizing and a lot of blog posting and things like that, but we have almost no empirical evidence about what's going on in these types of programs or how they operate, especially in a time like this. And that's going to be important for thinking about policy design because a lot of the questions you would need to think through these types of policies, we don't have answers to. So there's sort of the standard ones that are true anytime you're trying to design social insurance. Does it increase consumption? Does it change business outcomes? But then there's also a set of what we'll think of as sort of COVID-specific issues that have come up when thinking about the role of unconditional cash transfers. So for example, there's been a lot of theorizing about this idea that shutdown is a luxury. So for example, could getting cash to small businesses actually incentivize them to close down? Or to put it differently, if you get changes in consumption, do you also get the public health benefits of the transfer for free? That's one question we sort of don't have an answer to, but also if these businesses do in fact decide to stay open, you might also think that getting more cash to them would induce changes in a way that might mitigate some of the risk of running a business. So for example, you might think getting them more cash might incentivize more PPE spending on masks, on hand sanitizers, things like that. Or you might think that they induce more, say, public health specific management practices, like for example, restaurants eliminating in-person dining and instead switching to, say, takeaway. Now, we think these are important questions on their own for thinking about how to design policy during a crisis like this. But I'll also just point out that if you've seen some of the macro work on these same topics, where people are designing optimal policies in these modified SIR models, these types of elasticities are critical for understanding the quantitative trade-offs that are involved in those models. So we think it's both important directly and also sort of speaks to the broader debate going on right now about how to design policy. So what we're going to do in this paper is we're just going to run an RCT in which we deliver unconditional cash transfers to a particularly vulnerable group of people who are female microenterprise owners in a slum outside of Nairobi, Kenya. And literally what we're going to do is we're going to deliver what amounts to about 1 month of profit during normal times. And we're going to deliver it lump sum via mobile money right around the start of the crisis in Kenya. So we're going to deliver this cash in mid-May. And as I'll show you in a few minutes, this is right before the number of cases really starts to skyrocket in Kenya. The context in which we're doing this is that, as I just mentioned, these are people who have not been covered by a lot of the policy that the Kenyan government has implemented. So for example, only 17% of people in our study have received any benefit from the government, and only 5% have received any type of benefit from NGOs. This is like a very vulnerable population who does not seem to be covered by existing policy. And so what we're going to do is we're going to study what happens when you get them unconditional cash as the crisis is expanding in Nairobi. So what are we going to find? Just to give you a little bit of a preview, sort of the headline thing I think to take away from this is that the enthusiasm for these types of policies does seem to be warranted. So what we're going to find is that profit increases by 40% relative to the control group here, and food spending as well is going to increase by 7%. Now, something I'm going to come back to quite a few times during this presentation is the interpretation of percentages. We're explicitly looking at a period of time in which the level is quite low, right? I mean, almost by definition. And so, you want to be a little bit careful about thinking about what 40% means, only because we're dividing by a very small number here. So just as a different way to interpret the change in profit, what we're going to observe is we're going to observe about a 50% drop in profit between January and May 2020 before we institute any of the treatment. This 40%, the treatment effect that we generate in terms of profit, is going to get businesses about 1/3 of the way back to where they were in January. Right? So it's not going to be the whole drop, not the whole COVID-induced drop, but it's going to push them back up a bit. So the economic enthusiasm is warranted, but what we're also going to find is that you have to be a little bit careful here because you're not going to get the public health part for free. It's not going to be the case that businesses are going to shut down because you give them cash. And in particular, what we're going to find is that businesses are in fact more likely to be open in response to the treatment. And that's going to be entirely driven by this massive reopening of firms who get cash. So what we're going to find is that a number of firms end up closing during the initial contraction, and then we're going to hand them cash, and 65% of them are going to reopen in response to that cash. So in fact, it's going to sort of go the opposite way. So if you're thinking about policy here, there does seem to be a trade-off between the economics and the public health of delivering cash. Now, of course, one way in which this public health effect might be mitigated is if the transfer also induces people to change their business practices. And in fact, that's exactly what we're going to find. So what we're going to find is that people spend about 15% more on personal protective equipment. So again, think masks, hand sanitizer. And we're also going to find that these businesses start doing what we'll call public health related management practices. So we're going to find that the firms in the treatment group are more likely to enforce social distancing, switch from in-person dining to takeaway, require customers to wash their hands before they come in. All of these things that we think of as now sort of standard practices to mitigate the effect of opening a business. And then finally, one last point here, when we dig into who are the firms that are making these changes, it turns out that it's only going to be done by firms who are properly estimating the COVID-19 health risk. So I'll show you some information on beliefs in a little bit, but there's going to be a distribution of beliefs in terms of how deadly people think COVID-19 is and sort of how big of a health risk it is. Only those people who properly estimate the severity of the crisis are going to start spending more on PPE. So what we think here in terms of policy is not only are there issues of public health that you want to be careful about in terms of reopening, there's also some complementarity here with information interventions that can potentially lower the public health risk of reopening without necessarily dampening the economic gains that these types of programs can generate. Okay, so that's just a brief outline. Where are we going to go from here? I'm going to talk a little bit about Dandora and COVID just to give you a sense of sort of the scale of the contraction. And then we'll talk a little bit about how we do the RCT and what we find. So maybe I'll stop for a second. Yeah.
Yeah, sorry. Yeah, there's a question. It's from Federico. And let me... Let me ask you a question, Federico.
Hey, Kevin, how are you?
Hey, good.
So maybe you're going to talk about this later, so feel free to defer if that's the case. So one concern is spillovers. Do you think that in terms of the implementation, there might be some of the effects are actually spillovers, that, you know, the treatment are sort of receiving effects from like business stealing from the control group? And if that's sort of the case, kind of a related question, what do you think about like the scalability of this type of interventions in this case? I mean, there's a lot of debate about not only whether you should help firms, but also how targeted it should be in this type of a massive shock. So, you know, I'm curious to see what you have to say about that.
Yeah, it's a great question. So the short answer is we're not going to have much to say about it. We don't think it's a problem for us. I'll talk a little bit more about this in a second, only because the scale at which we're operating is small relative to the market. But in terms of sort of what this would imply about scalability, it's tough to say at the scale that we're working at. We did some work in which we just sort of asked people why they were reopening. Excuse me. And it doesn't seem to be sort of like connected to business stealing, though, of course, you know, it's sort of tough to say. But so to be specific, we're not going to have much to say about rolling this out at scale or what sort of the general equilibrium about this policy is. I think for that, you'd need, number one, a better RCT than the one we're doing that sort of thinks seriously about, you know, treating various neighborhoods more intensively or something like that, or you sort of need to take the structure of the economy a little bit more seriously and build it into a model.
Okay, thanks.
Kevin?
Yeah.
Yes, hi, Kevin. Andres Fernandez here. A couple of clarifying questions. So sure. This is, if I understood correctly, this is an unconditional cash transfer program to firms.
Correct.
Right. And the objective is to keep them afloat.
I wouldn't say that. I think the objective, as we're seeing it, is we're trying to get resources to businesses. We're trying to get resources to business owners, let's say, right? So I don't want to draw too strong a distinction between the owner and the business. So what we're trying to do is figure out, you know, can we generate something that looks like social insurance by just handing resources to people? We don't have a prior on whether businesses should open or close, but that's, of course, something we're going to look at.
Yes, because that's where my next question was headed, right? Like, why directly target households instead of firms? But I sense that there's kind of like a blurry distinction, right?
Yeah, that's exactly right. So I would think of this, I would think of what we're doing as the following. There exist households in which the way the household earns income is that they run small businesses.
Mm-hmm.
Those small businesses are sort of on the front line of the shock here. We sort of expect them, given all the previous work that's been done on this, to be hit hardest by this shock. So you should think of what we're doing as delivering the money to the household, which is literally what we're doing. The way that's going to manifest itself is that some of it's going to get spent directly on consumption, perhaps spending on kids, school fees, that kind of stuff. And then some of it's going to show up in the business because that's how they earn their money, right? So the money itself is going to the business owner. There's no sense in which they have to use it on their business.
I see. And what are the time expectations? So what is the information set that they are given in terms of how long this program is going to take place? What are the conditionalities for the program?
Can I hold off on that until this second one right here? I'll talk a lot about how we implement the randomized control trial in just a couple minutes.
Sure. Okay. Thank you.
Okay. Thanks. Yeah. And of course, if I don't answer it, please stop me.
Okay. Just one more question from Pablo Munoz.
Sure. Yeah.
Go ahead, Pablo.
Okay, guys. Okay. Thank you, Will. Hi, Pablo Munoz here. Kevin,
yeah.
on your previous results on reopenings, so you compare it with the initial the first lockdown, right? What about the control group? Does this the control group also increases their reopenings? Because I'm imagining like the first time there's a lockdown, everybody is concerned about health, but not of the economic repercussions. So I don't know if this is the RCT, the unconditional cash transfer, or is it just, hey, it's a lockdown, I need money?
Sorry, let me take sort of two parts of that question. Your point about sort of the initial contraction, I think, is spot on. That's going to turn out to be a really important point, and it's going to be really useful for us in sort of thinking about how the economics of this program works. That's not part of the RCT, of course, but we can see what happens when the Kenyan government makes decisions about how to lock down the economy and things like that. And we can observe what happens when firms get shocked, and then we can observe the response in terms of the RCT. On your second point, perhaps this is a bit narrower. Everything I'm telling you is the impact of the RCT by sort of the notion of the fact that it's an RCT. So I don't necessarily agree with this distinction about what part of it is, how much of it is just sort of we're concerned and how much of it is the RCT. Everything here is relative to a control group that is going through whatever the aggregate state of the economy is at that point, right? So I have a feeling what we're sort of saying is something similar to what I was saying here, which is you want to be a little careful about how you interpret that difference, only because the control group is going through something that is pretty intense. So I'm not entirely sure how to answer that question other than to say, we're going to use a lot of what's going on with the control group to think about what firms would have done had they not been given this cash. And I'll sort of show you what happens as they close and as they open and how they change inventories and buffer stocks and things like that.
Okay.
Yeah, Kevin, that's all we have for now. And so you can go ahead.
Okay, great. Yeah, and obviously if I didn't answer anyone's questions, please feel free to stop me again. So I just want to give you a very brief background on what's going on in Dandora and what sort of COVID looks like. If you're not familiar with Dandora, it's a slum outside Nairobi. It's about 150,000 people in a 2-by-2 kilometer square area. It's the site of sort of the trash dump for the entire city of Nairobi, which, despite the fact that it was declared full in 2001, is still operating. I bring this up only to point out that there's been a lot of work in Dandora about the respiratory issues that living next to a, one of the world's most polluted sites does in terms of, your health and your respiratory issues, which may play a role here to some extent. In particular, our sample that we're going to look at are people who we think are particularly vulnerable to such a downturn for a few different reasons. One is that even in the best of times, these people are earning around $2 a day. I'll show you that during the initial lockdown, that dropped to about $1 a day. They're running businesses that are primarily non-essential retail, so mostly storefronts or, say, production like furniture or tailors who are then selling from their same storefront, restaurants, all of which rely on face-to-face interactions to conduct business. And there's been some really cool work, I think, in Colombia about understanding sort of like how these businesses in particular are going to be affected. And then finally, I'll just point out, and if I have time at the end, I can talk a little bit about this. One of the perhaps unique aspects of COVID-19 relative to a standard recession is the gendered aspect of it. So this has been pointed out in a lot of cross-country work, but there's also been a lot of recent survey work around Nairobi and the slums around Nairobi about how women are particularly bearing the burden of COVID-19 in the form of more homework as kids are home from school and things like that, potentially at the expense of business. So what has the government done in Kenya? This graph right here is the cumulative number of cases in thousands from January up until just the end of last month. The first case is March 13th. The government implements a number of public health related measures like almost immediately. So Kenya, was very early in how they responded to this, for better or worse. There were plenty of news reports about the role of the police and the military and these types of things too. But on March 15th, they institute a curfew that limits nighttime business, the international travel ban. March 22nd, bars and restaurants get closed down. And then on April 6th, they suspend all travel into and out of Nairobi to limit both people coming into the city, but also people from the city leaving and going back to where their families are in rural areas to prevent some of the spread. Now, of course, at the same time, they're doing a bunch of economic stabilization where they're reducing income taxes. On April 1st, they suspend all negative credit listings for overdue loans, which was supposed to be designed to help SMEs. They also lower VAT from 16 to 14%. Now, if you look at all of these stabilization policies, you can sort of see they're all sort of targeted towards the formal sector. And not that, of course, you would expect the government to necessarily do anything different, but one of the outcomes of that is that very little of that effect ends up in Dandora or ends up in these slums. So as I said at the beginning, when we look at government support, only 17% have seen any sort of support from the government. Most of that is people pointing out the income tax reduction. 5% report any support from an NGO or anything like that. So it doesn't seem like these people are necessarily getting helped directly by the types of stabilization that the government is doing. Now, if you look at what's going on with profit among these businesses, this blue dashed line is data that my co-authors and I had collected for a separate project from 2014 to 2016. This is just the time series that runs through that data. And then we've overlaid on top of it our current data collection, which started in October 2019, runs up to January 2020. And you can see the big contraction between January and April here. So this roughly amounts to $2 per day in January, becoming $1 per day in May 2020. If you want a comparison, it's 50% lower in April 2020 than it is in April 2016, despite the fact that profitability seems to be roughly similar leading up to that contraction. If you ask businesses what's going on here, it seems to pretty much be demand. So none of this is particularly surprising at this point, I don't think. But if you ask business owners what's going on, they have fewer customers, and in particular, they have fewer nighttime customers because of the way the curfews are structured. There's some other issues. Transportation infrastructure was strained quite a bit because of the curfews and people trying to get on buses all at the same time all over Nairobi. And then there's some other issues that we thought might have been important, but don't seem to be mentioned quite as much as the demand side here. All right. So finally, I mentioned this at the beginning, but so there's an economic contraction, but do people actually believe that this is a problem? And the answer seems to be, to a first approximation, yes. So when we asked people what types of diseases they thought COVID-19 was most similar to in terms of health, these numbers in parentheses are the expected death rate per 5,000 people if left untreated. These numbers are from the WHO. And so we gave them those numbers as well to try and roughly bin how serious COVID-19 is as a health risk. And what you can see here is that about 50% of people put it in the Ebola bin, which is, the death rate or the risk of COVID-19 is still a bit uncertain, but even the most extreme bounds say that it's more deadly than the seasonal flu and less deadly than typhoid. So it should be somewhere in the middle here. That doesn't seem to be what we find. What we find is a lot of people seem to overestimate the beliefs, and then quite a few, like about 1 in 5, still seem to underestimate it. I don't know what those numbers are in different countries, but there does seem to be this bimodal distribution. Now, of course, that's not to say that these beliefs necessarily need to be corrected, right? This is a world where externalities seem to play a critical role. So the fact that people are overestimating risk is not entirely it's not entirely clear that that's inefficient. But we'll come back to this, and we'll use this variation at some point to think about how people respond to getting cash. All right, one final thing here. It does seem like management practices that we think about as related to COVID-19, these now standard practices do seem to be taking place. So people are wearing masks. Most of them are using hand sanitizers and mandating social distancing. One of the things you don't see here is that those things don't require a business to close, nor do they necessarily change the customer-owner dynamic. You don't see a lot of other stuff here where people are not limiting their direct interaction with customers. A large fraction of them are not sort of only allowing pickup as opposed to people coming into the store or anything like that. But sort of these standard ones that we've all sort of internalized at this point, hopefully. If we weren't recording, I could tell you some of the people who are not, I guess, in the US these days. But to a first approximation, they're doing all of the right things. Okay, so let me now, that's sort of the context in which we're going to deliver this RCT. Let me tell you a little bit about how exactly we do that. So as part of a separate research project, we had been in the field in Dandora collecting a 4,500 microenterprise survey, cross-sectional survey, for a project on knowledge diffusion that eventually got put on hold because of all of this. And so what we decided to do as COVID became sort of a more and more serious issue, we drew a sample out of 800 microenterprise owners to study the impact of just getting cash, because this was something that people seemed to be talking about quite a bit. So to Fedi's point just a minute ago, this is sort of why we don't think there's going to be a big general equilibrium effect, only because this is a 150,000 person area. Most people are running businesses. We're only drawing out 800. And so we're not going to be able to necessarily speak to the GE effects here. I should also note, we drew the sample in such a way that we weren't clustering businesses, control and treatment near each other. We can test for spatial spillovers because we have their GPS coordinates and everything like that, and we don't find any. So we drew this sample, and then from April to August, we just ran continuous follow-up surveys. So we just continued to call people over and over again to collect data. So we'll just have continuous data through April to August of 2020. The treatments were all delivered on May 12th. The treatment is 5,000 Kenyan shillings. That amounts to about $50 US, or about 1 month of average profit in January 2020. The control group gets 50 shillings, which is about 50 US cents, because we're calling them on their phone over and over again. So we at least wanted to pay them back for phone charges or for data. Everything gets delivered via mobile money. So this is one of the things we really like about this, is that this is something using existing telecommunications infrastructure that a government could just as easily do without having to go out and, you know, interact with people in person or have them be part of the social registry or anything like that. So just to summarize all of this, oh, sorry, I'll just mention one more thing. One of the nice parts about this, and this came up in a couple of the earlier questions, we're going to observe everybody twice before the treatment. We're going to observe everyone in January 2020. Then the Kenyan government is going to come in and institute a bunch of those policies I talked about. Then we're going to observe everyone again in April or May, or early May, and then we're going to deliver the transfer. So we'll be able to track the heterogeneity based on how people respond depending on the size of the shock they experienced before we got there. All right, and then just to summarize all of this, here's that same picture of cumulative cases in Kenya I showed you. The only difference is that I've now overlaid it with when we deliver the cash and when we collect data. So these pinkish bars here are when we're collecting data. And a couple of things to note. One is that we're delivering the cash right before the big increase in cases in Kenya, but after the government implements most of their first wave of policy. And also we're going to be collecting data as the number of cases increases. And in fact, we're going to use that, I'll use that in a couple places to think about how beliefs and how spending changes when the government is making pronouncements about how bad the crisis is getting during this period.
Kevin?
Yeah.
Sorry, just a clarification question about the design. For an enterprise to get the treatment, needs to be operating at the moment of treatment?
Good question. Thank you. So no, in fact, that's going to be a big thing for us. So what they had to have done is they had to have been in our original survey here. So they had to be operating in January. We'll deliver the transfers in May, but one of the things I'm going to show you is that about 20% of them close somewhere in here. And so operating here is not a requirement to get the transfer. Now, none of these businesses had closed completely. It seems like 99% of them had closed temporarily because of the COVID shock. But you're right. Yeah, absolutely. It's not a requirement to be open here to get the treatment.
I see. And just a related question. So did you see that maybe the firms or the households that expend most of this money in personal consumption are actually the firms that have been that have closed before the transfer?
That's a great question. So that was also my prior. I'm going to show you it's almost the exact opposite. And so I'll talk a lot about this. This is the thing that is most surprising to, I won't speak for my co-authors. It was most surprising to me for sure, right? Because that's exactly what I would have thought. As you're bumping up against these subsistence requirements, you should be spending that on consumption to sort of, get out of that high marginal utility point, right? A high marginal utility of consumption point. I'm going to show you the opposite. And what I'm essentially going to show you is that, in a world in which credit markets and borrowing markets don't exist, what you're going to see is you're going to see people actually use the business itself as the way to intertemporally substitute consumption. And so instead of sort of spending it on cash, they're going to use it to rebuild the buffer stock of inventory so that they can reopen their business. So that's going to be a big part of what we find, and I think it's sort of the most unintuitive part to me, at least. But yeah, that's a spot-on question.
I see. Thanks.
Okay, so I'll just show you this one last slide, and I'll stop a second if there's any more questions. The treatment and control groups are balanced. There's a lot of numbers on this slide. Just to summarize, here's the joint F test. The p-value is 0.98. So for all intents and purposes, our control and treatment groups are balanced. So that's sort of the end of the implementation. If there are questions about how it gets implemented and that kind of stuff, let me stop for a second just in case.
I just have a quick question about, like, so some of these businesses have mandatory restrictions on operation. Like, are they all capable of opening if they want to, or some of them cannot open due to regulations?
Great question. So no, so there's no sort of formal restrictions on whether these businesses should be open or closed. They are all in principle subject to the curfew, which suggests, or which mandates that all businesses close, I think at 10 p.m. and then, or 9 p.m. and then 10 p.m. As far as we can tell, that was not enforced in any sort of serious way. But there's no restrictions on the fact these businesses needed to close down. Okay, so let me get into some results then. All right, so we're going to run this as just sort of a fixed effects regression. I guess the beauty of running RCTs is that my inability to do serious econometrics doesn't show through too badly. So this is going to be some outcome Y for person I at week T. There's going to be a treatment indicator. And then because we're running these continuous surveys, we're going to have an unbalanced panel at sort of any given point in time. So we'll include fixed effects for individuals and fixed effects for the week of the survey itself. So this is going to knock out whatever sort of aggregate trends are going on, but at some point we'll come back and we'll use those aggregate trends to dig into some of the details. Standard errors are clustered at the individual level. It turns out you can run this basically any way you want. You'll get the same results. It doesn't seem to be a function of how we specified anything. Okay, so here are sort of our headline results. So if you just ran the RCT and you just wanted to know what the average effects are, here are the ones that seem like they matter the most. All right, so let me just walk you through this in a little bit. So what we see is that profit increases by about 40%. We see a similar change in revenues. As I mentioned at the beginning, this is about a third of the decline that we observe in that initial wave of the shutdown before the treatment. Now, if you look at where that profit goes, some of it gets reinvested in the business. We see inventory expenditures increase by 66%. This, again, you have to be a little bit careful because, as I'll show you, the control group is actually declining quite a bit during this period, but it is a big reinvestment in the business. And then some of it gets consumed. So we can see consumption go up by 7%. Now, if you're anything like me, you see these two numbers back to back and you think like, boy, this really doesn't seem like it's doing much to consumption relative to what it's doing to the business. And I'll sort of we'll dig into that result in a little bit. Finally, when I started, I mentioned that there seemed to be this tension between public health and the economics. And this is what I mean by it in sort of the average treatment effect. We see that businesses are about 5 percentage points more likely to be open off a pretty high base. So most of the businesses we observe are sort of back open already, even in the control group. And they're operating at about half an hour per day more than the control group. So it's true that this is helping consumption. Consumption goes up by 7%, but they're also operating more intensively. Now, of course, we don't have the interaction data or the true health data that you would need to sort of marginally figure out the net benefit versus cost of these things and sort of the economics public health trade-off. But it does suggest that if you're thinking about these types of policies, you can't just sort of assume that all of it is going to go in the right direction and it's always going to be a benefit. Okay, so if we think about this type of trade-off, we want to sort of dig into these effects a little bit. And so like I mentioned, we're going to have 2 observations before the treatment actually occurs. We're going to have one in January. Then there's going to be all the government responses in March and early April. And then we're going to observe them again in early May. And then we're going to deliver the treatment. So as somebody just mentioned, it is not required that the business be open in May to get the treatment. And so we're going to use the variation before the treatment as to understand some of the heterogeneity in this effect. So in particular, what we find is that between January and May, 19% of these businesses closed down. As I was saying, this is primarily temporary. It's not like these businesses are closing or people are sort of shutting down ever running a business or going to work somewhere else. They're sort of shutting down the business temporarily due to lack of demand. And so what we're going to think about now is, how does the impact of the treatment vary depending on whether you were forced to close your business between January and May? Right. So these are the same results. The only difference here is that I have the treatment indicator and then the excess impact of being closed in May 2020 before we delivered the treatment. All right, so let me walk you through. There's a lot of numbers on this page. So let me sort of walk you through it piece by piece. Let's first think about who are the businesses that are reopening here. If you do this, what you find is you find this massive effect of businesses that were closed that are now reopening. So there is some evidence that some of these businesses are in fact closing in response to the treatment if they were originally open. About 7 percentage points off a base of 91% of these businesses being open over time. But what you get instead is about 65 percentage point, if you add these two numbers together, reopening. So these businesses that are closed, a huge fraction of them end up reopening because we handed them cash. As you might expect, those businesses end up generating the big change in hours that we observe. And you average these things out and you get the response that I showed you on the last slide, which is that on average, you see businesses more likely to be open and working more hours. So this seems to be a function of just reopening businesses in response to cash. If you look at profitability, this is sort of what you would expect given that they're reopening, right? They're reopening and they do seem to be catching back up to the firms that were open before. So just to give you a sense of how to think about this is sort of back of the envelope economics here. But if you look at the control average, firms that were closed in May earn about 1/3 of what firms that were open in May earn. So this is the average across the entire time series. So what this is saying is that if you were closed in May, you're still doing quite a bit worse on average than firms that were open in May. If you look at the treatment, closed firms are 87% of open firms. They're earning 87% of what open firms were ordering. Sorry, earning, not ordering. So what this is saying is that the treatment effect is allowing these firms that were closed in May to sort of catch back up to the firms that were open in May. And similarly, you see that they're rebuilding their inventory. So you see something very similar to what we see in profit. This is perhaps not too surprising given what I just showed you. But if you look in the control firms, those that were closed in May are expending about 33% of what those that were open were spending in terms of inventory. Once you look within the treatment, what you're getting is, again, they're catching up in terms of their expenditures to the firms that were open. So the way to think about this is that, in the control group, some firms close and some firms open. And then there's this persistent gap between those two groups over time. What the treatment is doing is it's allowing those firms that were closed to catch back up to the firms that were open. And so that's sort of the key thing. It's this sort of catch up in terms of inventory and in terms of profitability. Finally, what's kind of interesting here, and this gets back to the question that was raised about consumption, if you look at food expenditures, you sort of see the opposite, right? Here, what you see is that if you were open and I hand you 50 US dollars, 5,000 shillings, you increase your food spending by 9%. If you were closed in May, you only increase your food spending by 2%. Right? So it seems like what the treatment is doing is it's taking these closed firms and it's allowing them to increase their business revenue much more, but they're increasing their food spending by much less. So this is sort of where this is all coming from. Let me stop for a second. I know there's a lot of numbers on this slide, and so just in case there's questions, otherwise I'll keep going.
Kevin, yes, one question.
Yeah.
So I'm trying to understand what's the mechanism. So how does giving a firm some cash make them want to reopen? I mean, giving them cash is not going to bring customers, no? At some point they decided to close, and now you give them cash, and now they want to open. So what is it? I mean, you're saying that they increase inventories,
Yeah.
but that can be because they're selling more and they have to restock. So I'm trying to understand a little bit what's going on.
Yeah. So the short answer is so are we. So let me go through. I'm going to try and dig into this a little bit more and highlight what we think is going on. And then I think we can have this discussion again in a few slides and see if you're convinced or not. If that's okay. Great.
Okay, Kevin, may I ask?
Yeah.
Sure. Do you have information about the regulations or the obligations of people having to wear protective equipment in this area? So maybe
yes, sorry, go ahead.
Maybe some business cannot open because they don't meet the regulations of the government because they couldn't get protective equipment, and they something like that going on.
From our survey evidence, that does not seem to be what's going on. There doesn't seem to be much regulation on that front. The curfews do seem to. There was some discussion about sort of like the role of the curfews in all of this. Those seem to be regulated more strongly, but as far as we know, there's no regulation that says, somebody's going to come and shut your business down if you're not wearing a mask or something like that.
Okay. But it could be the case that people, for self-consciousness, they want to get equipment, but they didn't have the money to get equipment. So it could be
Indeed.
the case where...
I'll show you. I'll in fact show you exactly those results in a few minutes. Yeah, that's right. So I'll I'll show you what happens to that type of spending in a few minutes. Yeah.
Okay. Thank you.
Yep. Great. Yeah. So let's probe this a little bit, because I sort of agree with a couple of the questions that comes up that this is not sort of the most obvious way that you would think giving cash to people would manifest. Let's dig into that a little bit. So just to sort of highlight this a little bit, let me stop for a second and say, all right, what the results show is that if you look at firms that were closed in May, the treatment generates a larger change in inventory than treated firms that were open in May, but a smaller change in food consumption among the treated firms that were open. Than the treated firms that were open. Right. So what we want to think about a little bit, and I agree with these points that it's not super obvious why that would be going on, is sort of why the treatment has this heterogeneity in it along this dimension. And to try and dig into that a little bit more, I'm going to look at the impact of the initial shock on these businesses. So what are they adjusting before the treatment actually happens?
Sorry, Kevin, just a short question, since you're going to talk about this. Since a lot of these shops are restaurants, inventory can be food, right? Is that the case? Okay.
Yep, that's right. Okay, so this is in January. This is January 2020, before we were all privy to what was about to come. And what this is showing you is it's showing you the inventory here, these first two bars, and the profitability of these firms based on whether they were closed or open in May. So this is, I've wildly selected this to get a result that you'll see in a second. But what I want you to take away from this right now is that maybe the firms that ended up closing were a little bit smaller and less profitable, but certainly not wildly so. And in fact, statistically anyways, you can't distinguish them from each other, both based on these factors and any other things like, you know, education or sector or anything like that. Okay, so then if you look at, now what I'm going to show you is these two same patterns, but in May. So after the government institutes these regulations and sort of the initial wave of the COVID shock hits these businesses. And what you see is you see exactly what you'd expect, right? Businesses that closed have no inventory spending and they have no profit. It's almost like the definition of being closed. So if you look at businesses that were open, you do still see some decline. They're spending less on inventory. Their profits go down, but you know, obviously not by as much. So this is sort of what you would expect. This is just the initial impact of the shutdown generating declines in inventory spending and declines in profit. Now, the last thing I want to show you is how these two groups look in terms of their food spending. And there's no variation in their food spending across these two groups. Right, so what you're getting here is you're getting massive adjustments on how much of their budget they're spending on inventory. But in terms of consumption, it doesn't seem to be changing that much. So I've only shown you food consumption here, but we look at other types of spending, more durable spending, and you're not seeing any change there, mostly because they don't spend much on durables. And so this right here suggests the margin that people are changing their budgets on is not on food consumption, but instead on their ability, on how much they're willing to spend on inventory. So if you're thinking about this in sort of like a, you know, what's sort of the buffer stock part of this, they're dropping inventory expenditures, profits going way down, so you've got the change on the income side and the expenditure side, but the food spending itself is being held up. And so we're going to use this to think a little bit about, it seems like what's going on here is that the inventory margin is the one that's doing all the adjusting so that people can hold their food consumption spending relatively constant. So, right, so as I was saying, what's going on? Well, at first, you get people that are hit hardest by this shock, and what do? They adjust their inventory so that they can prop up their food spending. And then what is the treatment? The treatment is their ability to sort of resupply that business and get back open. Right? And so for some reason, like the model you have to do this in is not super complicated, but it requires some, you know, if you think that food spending is, say, not particularly income elastic because of subsistence requirements, you can get this type of adjustment. But what it highlights is sort of this more general point that the input adjustment, it's what's going on to intertemporally move resources. And so this is a general point that's made in a very nice AER paper that's coming out by Kelsey Jack and a few other people on the fact that if you don't have credit markets, it's really the business angle, it's the business decisions that are going to help you move resources across time. Now, that's fine in a general point, but also we think that there are COVID-specific implications about this, which is if reopening has public health concerns, you're sort of ending up conflating these two things, both the increase in sort of how people are resupplying businesses, but also the public health concerns that come with it. Now, I'll just make one more point on this, which is if you think that this is what's going on, and you sort of agree with the points that I've raised so far, one of the things that comes out of this is the control group who was closed at the beginning. These people should be really vulnerable to other shocks, right? Now you have the control group who closed. These are the people who have no inventory and don't get any cash to readjust that inventory. Now, this is a little tricky because it's not like we have another shock in our back pocket in terms of the RCT, but instead, I have enough time to do this. let me show you what happens when we use government announcements in terms of what they're sort of putting out as their policy. So, right, so the firms that are closed at baseline, but in the control group are these firms that can't rebuild inventory. And so I'm going to use variation in government announcements to see if, in fact, their food spending drops when the government makes some announcements about what's going on in terms of their policy. So what do I mean by that? Turns out there are two major announcements that happened during our study. One is on June 6th. The government decides that they're going to extend both the curfew and the movement restrictions into and out of Nairobi. And then on July 6th, our research assistant in Kenya said that this has been jokingly called Independence Day because the movement restrictions are lifted. Now you might wonder, okay, how do people actually respond to these types of things? What I'm going to show you is the fraction of businesses who think that COVID is not that big a deal in terms of the health risk. So these are the two major policy announcements. Here's the fraction of businesses who are sort of underestimating the health risk of COVID. And what you can see is it sort of tracks this pretty amazingly. So what this is saying is that around 20–25% of businesses are claiming that COVID is not a particularly large health risk. The government says, this crisis is about to get worse. We're going to extend all of these protections. And then what you see is that very few people end up actually claiming that this is people take more seriously the health risk. Once this movement restriction gets lifted, you see this sort of go back up. So people are, yeah.
Yes. So just to see if I understand, like, so following on Bernabé's point, like, so the initial concern of the businesses was about demand, right? They experienced a shock in demand that lead to less customers and less sales. So,
that's what they're claiming, yeah.
So the mechanism is going to be like people, like over time, demand will recover because people are concerned about COVID or they'll get used to COVID or whatever. And businesses that have the money are able to rebuild inventories faster so they can face this new demand and take advantage of it. While other businesses can. Okay.
Yeah.
So there's a T that's like provides some money to be able to reopen when demand rebounds, in a sense. So that's
yeah.
Kind of
so that's right. Now there's a slight subtlety in here, which is that you don't need theoretically you don't need demand to rebound that much for people to do this. As long as you get sort of like as long as people like. No, I won't go into it. We could talk about, there's some interesting theoretical ways on how you generate this that I'm happy to talk about afterwards. But yeah, that's right. That's right. The world is sort of reopening, and so people are reinvesting and sort of using that to expand, to respond to the increasing demand. Mm-hmm.
Yes, I have a question related to previous points raised. I just want to make sure I understand what is your view on what determines the fact that some firms close and some others don't, right? What is behind that? Because it seems to me, but I might be wrong, that I'm sensing that you assign these to probably bad management techniques, or that you have a firm, I have another, we ex ante are similar, we're in the same business, the same size, etc. We get hit by the same aggregate shock. You close, I continue to run. It's because I am better at managing my business, and hence when you get the treatment, you get this lift back in business, right? Am I getting the story correct, or?
Yeah, so this is a good question. So I'll give you sort of two sort of answers to this. One is we don't observe, there's nothing that predicts closure, right? So it's not the case that this is bigger firms or firms whose owners have more education or anything like that, or certain sectors. There's nothing that predicts closure. And so my interpretation of that is that this is a market in which there's just so much competition. I mean, this is sort of a classic story about doing business in slums, I guess, but you walk down the street and there are 10 businesses all doing the exact same thing. And so my basic interpretation of this is it's probably something in the background. It's probably some idiosyncrasies, whether they be management practices or just sort of like willingness to shut down house, those types of things, but we can't observe anything that actually predicts closure. So I'm a little hesitant to sort of suggest much of anything on that front. Basically, what we just want to say is, to a first approximation, these seem like similar businesses at baseline, some of which for some idiosyncratic reason decide to close, and for some other one, they don't for some reason. Yeah.
Kevin, related to this, there is not heterogeneity in savings just before the shock.
Yeah, great question.
It looks to me that is kind of a financial friction story in the sense that they are trying to smooth consumption, and in order to do that, I need to close or to reduce investment, and maybe there are some firms that have some savings and they can smooth consumption at the same time keep their investment at usual levels.
Yeah, great question. So that's exactly what we think is going on. The difference, I think, so we looked at heterogeneity by savings. It turns out nobody uses the formal savings market. So like there just is no sort of heterogeneity on that dimension. Yeah, so I think your story is exactly right. And the reason we don't see any of that type of heterogeneity is because there is no heterogeneity along that dimension, along that characteristic. There's just nobody saving much. These are primarily people who run their savings through the business, exactly as you point out. And so the margin of adjustment here is the investment margin. It's just sort of the investment versus the food. And so people are choosing the investment margin to sort of, act as the buffer. Exactly. Okay, so let me just show you very quickly. Okay, sorry. This is food spending. And so what I'm looking at here is what I want to see is, all right, do firms that never got cash and were closed at baseline, do they actually suffer during this period where it seems like this is becoming a real problem? And if you do that, that's exactly what you see. So the way to interpret, this is just a subset of regression coefficients on food spending. What this is treated firms that were open at baseline. And then this is the impact of being in that sort of like 6-week period for various types of firms. And the thing to take away from this is that if you look at treated firms that are open, it doesn't seem like this has that much effect on them. Maybe it's negative, but statistically insignificant. Oops, I switched those. If you look at control firms that were open in May and treated firms that were closed in May, those two groups look not exactly, but similar to treated firms that were open in May. Who's really suffering during this one period where the government is saying that this COVID crisis is really becoming a problem? It's people that were closed in May and in the control group. So these are people that had already run down their inventory to prop up savings early in the crisis and didn't get cash. The next shock that they face, their consumption is dropping quite substantially. Right, so all of this is to sort of try and point to this story that in a world in which people can't save and there are financial frictions, the margin that's going to hit is going to be this investment margin. And that's great at first, and it seems like everybody's able to overcome the initial shock based on what I showed you about food consumption. But then when another shock happens, that's sort of when all of a sudden this vulnerable group really sees their consumption start to fall. Oops, sorry, I shouldn't have done that. let me stop for just a second if there are questions about this. Otherwise, I'll head back. Cool. All right. So, yeah, and I'll just point out again, this is not, this is not something that we came up with on our own. There's been a lot of really interesting work, both sort of in macro and micro, about sort of how these investment margins should matter in response to, in a world in which credit frictions are pervasive. Okay, so what you see so far is that businesses increase profitability, they spend more on food, but they're also open longer and they're working longer hours, which suggests some sort of tension between the public health and the economic benefits. But of course, if the treatment is also changing business practices, that might mitigate some of this effect. So what we're going to look at now is exactly that. Are people changing the way they do these business practices in terms of how much they're willing to spend on PPE and then public health related management practices? And when you do that, you see that they do in fact seem to be spending more, changing practices in this type of way. This is a Z-score of management practices that I showed you much earlier in the talk. This is, are you social distancing, are you enforcing social distancing in your store? Do you require customers to wear a mask? Are you changing from in-person dining for restaurants to takeaway, that kind of stuff? And then this is spending in shillings on masks and hand sanitizers and other types of PPE. And indeed, people do seem like they're changing practices in response to the treatment. Now, as I mentioned before, we have these variation in beliefs on health risk in May. This is already after the government shuts down, but before we deliver the treatment. And what I'm going to do is I'm going to call these people who think that the COVID health risk is similar to the common cold or the flu. I'm going to call those people who are underestimating the health risk of COVID-19. And when you interact the treatment with this indicator, what you end up with is that those people are not changing their practices at all. So if you take the difference between these two things, what you end up with is roughly a 0 for the people who underestimate the health risk of COVID, both in terms of PPE spending and on whether they're changing their practices. And so it's all coming from people who are properly estimating what the health risk of COVID-19 is. And so this sort of suggests that one way to lower the health risk while keeping the economic benefits of these unconditional cash transfers is to sort of figure out a way to change beliefs. So I'll just show you, good, okay, that's what I just said. Let me just show you one more thing here. This is the same graph I just showed you a minute ago. This is the fraction of businesses who are underestimating the health risk of COVID-19. Again, plotted with these two policy announcements that I was mentioning just a minute ago. And what you can see is that the fraction of people who are underestimating the health risk, again, it falls pretty dramatically when the government comes out and says, this is indeed a problem. We are going to extend these restrictions above where we did. If you track PPE spending over this time period, here's what the control group looks like. You see this decline in PPE spending over time. As people are mentioning, this is sort of, people are sort of, I guess one way to say it is that the initial sort of shock of how bad this is going to be maybe is declining over this time, that kind of stuff. So this is just the control group. They're decreasing the amount that they're spending on PPE. If you look at the treatment group, it's tracking almost exactly until this announcement, and that's where you see the big kick up in spending. So what the cash is allowing the treatment group to do is respond to this period where beliefs seem to be changing, either motivated by the government or the increase in cases during this time, where they're able to respond with more PPE spending to essentially insure themselves against whatever public health risk they believe that they're facing over this period. And then you can sort of see eventually, once the movement restrictions are listed, and now Kenya is sort of like officially has hit their peak in terms of cases, hopefully, you can sort of see this thing track back to where it was. So what you get is this decline, and then a spike, and then sort of the return back to the control group. You can do the same thing in regression form. So I've just broken out the PPE spending by these three groups over time. And what you can see is it's concentrated during that period where people seem to be reporting that they sort of estimate properly the belief or the risk of COVID-19 in terms of health. And so it's roughly double, maybe a little bit less than double than it is in these other two periods, either before the government makes this announcement or after the government relaxes all of its restrictions. So the response in terms of PPE seems to both be coming from people's individual beliefs, but also how those beliefs are responding to government pronouncements about the about the risk of COVID-19 over this time. Okay, let me stop for a second if there are more questions. Good. Okay. Great. So that is I'll mention a few other things. There are a lot of hypotheses right now about how these types of transfers should work. There's not a lot of evidence, and so we figured, given that there are all these other hypotheses out there, we should look at a few of the other ones, just a few of the most popular ones. We don't observe any difference in treatment effect by household characteristics. So we look at whether the women are married, how many children they have, whether they're the head of household. We don't see any differences on those dimensions. We don't see any differences in terms of the type of business that people are operating. And then we've done a bunch of other stuff, and we don't seem to see much effects on those types of margins. And I just want to mention, this came up just a second ago in terms of the bank account and the savings question. You shouldn't interpret these types of results as statements about how those characteristics matter more broadly. It really seems to be a function of the fact that the type of heterogeneity that we generally see in sort of more diversified or rich economies are just not so different in, Kenyan slums, right? So business diversity, for example, there's no essential services or production going on in these slums. It's all restaurants, it's all retail. And so the types of diversity the types of heterogeneity that come up in a lot of, how do different types of firms respond to the PPE, they're just not going to be an issue here. But regardless, when we do this type of analysis, we don't see much difference. Okay, so let me wrap up in the last minute or two here. We ran an RCT on short-run cash transfers during COVID-19, and the reason we did it was because, if you look at newspapers or you read government reports, everybody seems to be talking about these types of short-run cash transfers as good policy in developing countries. But as far as we know, there wasn't any empirical evidence that was sort of supporting this type of policy. And what we find is, indeed, the enthusiasm for these types of policy is warranted in the sense that profit goes up, food spending goes up, but there's some public health caution that needs to be observed because these businesses are reopening. And our argument is that that's tied to this idea that in a world with, severe financial friction, the investment margin is what's going to be doing a lot of the work. And so if you're in a world in which the investment margin is doing a lot of work and you can allow firms to recapitalize, that's going to come with some public health risk as they start to recapitalize and reopen their businesses. Now, some of that seems to be mitigated by how PPE spending changes, but as we showed a little while ago, that seems to only be a function that seems to only be true among those who are informed, which suggests potentially some complementarity of providing information along with these types of cash transfers. And overall, what we think is, if you start putting this suite of policies together, you can start to sort of figure out how to allow safer reopening by limiting some of that public health risk without necessarily losing some of the economic gains that seem to come along with this. So that's all I have. Thanks so much for your comments. They were super helpful, sort of clarifying some of the things in my own head as well. Thanks.
So now we open up for any additional comments or questions. If you have any, you can ask it in the Q&A and I can give you the mic. We can give a few minutes for that. Oh, Kevin, actually, I'm curious about if you have related the PPE spending with increasing profit or increasing revenue. Because it seems that these businesses are selling the same stuff, same good, but people could have the choice of going to a store that have more of these protective measures and stores that don't.
Yeah, good question. So in some trivial sense, yes, they are correlated in the sense that the treatment generates both higher profit and higher PPE spending. I haven't looked at, say, within the treatment group, or even within the control group for that matter, whether profitability and PPE spending are correlated. We should do that. We can also look at how PPE spending changes sort of depending on what people believe to be the constraints to the business, right? So we can say, like, are people who are worried that people are unwilling to come into their store because of COVID, you know, do people who say that that's their biggest constraint also spend more on PPE and do those types of things? That's a good question. Yeah, I don't know the answer. We should do that. That's easy enough to do for us.
Cool. I think there's no additional questions, so we can end the session now. Please, the panelists, please stay, and I will switch this to a practice session.